today we are going to cover meningitis. So it's an infection of the meninges in the brain or the spinal cord. So this is a medical emergency. So meningitis is caused by virus or bacteria, also fungi and parasites. The most common bacterial causes vary by age. So the key bacteria could be Neisseria meningitidis or Haemophilus influenza or Group B strep in neonates. And also monocytogenes in immunocompromised and elderly patients. So for viral meningitis, enteroviruses are the most common, followed by herpes simplex virus. So clinical presentation would be the classic triad of meningitis is fever, meningisms, that's a neck stiffness and altered mental status. But here's the catch. This triad occurs in less than half of adult patients. So in infants and children, symptoms are often non-specific. They could present with irritability, poor feeding, could be lethargy, and etc. So in advanced infection, shows signs of increased intracranial pressure, neurological deficits, and altered mental status or seizures, as well as decreased consciousness. So think headache, vomiting, and photophobia, and decreased consciousness. So diagnosis is confirmed with cerebrospinal analysis via lumbar puncture. We check cell counts, protein, and glucose in gram strain, gram stain, and culture, and PCR. So critical point is if you suspect increased intracranial pressure, like papilloedema, focal neurological signs, and altered consciousness, patient should get a CT of head before doing the lumbar puncture to avoid brain herniation, but never to delay antibiotic for imaging, and to start empiric antibiotic immediately, then to get the CT done, and then to do the lumbar puncture. So complication of bacterial meningitis includes permanent neurological deficits, especially hearing loss, brain damage, and end organ damage. So Waterhouse Friderichsen syndrome, that's adrenal hemorrhage from meningococcal meningitis, causing adrenal crisis. So prevention is key. Vaccination against common causes and chemoprophylaxis for close contacts and exposed to meningococcal meningitis. So if you find this useful, please like and subscribe. Thank you. Bye-bye.